Thank you, Dr. Shatner, for such a great talk. It was the perfect segue into my talk because I don't feel so alone being the neglected subspecialty. Pediatric pain wouldn't be a complete subspecialty without the involvement of pain psychologists, and that's one of the biggest things that we have to advocate for when we advocate for our programming. So that was the perfect introduction to my talk. So I'll talk to you a little bit about pediatric pain. The prevalence is actually relatively high. Depending on which epidemiologic study you look at, it's anywhere from 50 to 38%. If you look at headaches, it's actually a lot higher than that. And the estimated economic cost, if you look at some health expenditure data, is somewhere around $11.5 billion annually, which is more than health expenditure for asthma, obesity, ADHD, and pediatrics. Poor pain management in childhood affects quality of life of children and their families. It puts children at risk for continued impairment into adulthood. These are the really challenging adult patients that you inherit. And then up to 73% of children and adolescents with chronic pain will continue to have pain into adulthood, and they're likely to develop new pain conditions.